welcome to the deep dive. All right, let's jump straight in. Today we're tackling a topic that can instantly spike anyone's anxiety, especially if a child's involved. Head injuries. Whether you're, dealing with this as a parent, a carer maybe, a first aider at work, or perhaps you're a student revising, knowing the right steps is key. And knowing they're based on solid guidance, that makes all the difference.
It really does. Head injuries, well, they come in so many forms, don't they? From a bump you barely notice to something potentially, very serious. And it's that uncertainty, I think, that worry about missing something important, that can be overwhelming in the moment.
Exactly. So our mission in this deep dive is really to cut through that. We've been digging into the stack of UK first aid guidance and drawing on, insights from literally decades of real-world pre-hospital and training experience, the kind of experience that hears the questions people actually ask on courses. The worries that keep parents up at night. We want to pull out the absolute core, the clear, simple answers to those common questions, and really just refresh our understanding. Think of this as your focused study guide, maybe, or just a quick, reassuring refresher based directly on that guidance.
Yeah, the goal is to empower you. You don't need to be a doctor or a paramedic. But knowing the basics the guidance provides, understanding what to look for, and crucially, knowing when and how to get help, that's what turns a nervous moment into effective first aid.
And right at the top of the list of those common questions, the ones that sound a bit like myths you hear debated everywhere, are two big ones. First, can you really let someone, particularly a child, sleep after a head injury? It goes against what so many people think.
It really does.
And second, should you put a cold pack on a head bump? You see it done all the time, but what does the guidance actually say? We're going to unpack exactly what the sources tell us about these.
Okay, so let's start by grounding ourselves in the fundamental aims of first aid. Because the guidance reminds us these apply to every single situation, including head injuries. The three core aims are preserve life, prevent the condition from worsening, and promote recovery. Simple, but vital.
Yeah.
Everything we do as first aiders should tie back to one of those.
And the guidance makes a really crucial point about head injuries specifically, a point that underpins why we treat them with such caution. It states clearly that all head injuries, even those that seem minor on the surface, have the potential to be life-threatening.
That's the key phrase, isn't it? Potential.
It's that potential, that unseen risk beneath the surface that means we must take them seriously.
This is absolutely key. Because of that potential, the guidance is very direct. In all instances where a major head injury is suspected, qualified medical assistance must be sought immediately.
So just suspecting it is enough?
Suspecting it is enough to trigger the call for professional help.
Exactly.
You aren't expected to diagnose it on the spot, but to recognize the possibility and act.
Okay. The sources mention types of major head injuries to be aware of, like concussion, cerebral compression, skull fracture, things like that. They provide recognition signs for these, but the core message for the first aider seems consistent.
It is. If the way it happens, the mechanism of injury suggests it could be serious, or if you see signs that point towards one of these major injuries, your primary role is to get professional help involved. Fast.
Right.
And there's a very specific vital warning in the sources regarding suspected skull fractures. If you suspect one, maybe because of how the head looks, severe pain, or fluid leaking, the guidance says you absolutely must not turn the casualty's head.
Must not turn it. Why is that exactly?
Because a suspected skull fracture carries a high risk of an associated neck or spinal injury. Moving the head could cause further, potentially catastrophic damage. You need to keep the head and neck still in the position you found them.
Okay, that's really important. So how do we quickly get a handle on the situation to know if we should suspect a major injury and, make that call?
Well, the guidance provides tools. It reminds us about the scene survey, checking for dangers first. You might know it as CLA. Checks, look, assess, protect. And then the casualty assessment itself, starting with the primary survey, the familiar DRABCD. Danger, response, airway, breathing, circulation, defibrillation.
Right, DRABCD.
These are systematic ways to assess the casualty rapidly and decide if that emergency call to 999 is necessary.
And that decision to call 999 for a suspected major injury, that's probably the single most important first aid action you can take, isn't it?
It really is. The sources even give us the LINE acronym: location, incident, number of casualties, extent of injuries. It's just a guide to help you communicate clearly and effectively when you're speaking to the emergency operator, especially when you're under pressure.
Yeah, good tip. Getting that professional help en route early is paramount. Okay, so we understand the seriousness, the need to assess, and the critical step of calling for help for suspected major injuries. What are the general first aid steps the sources recommend for head injuries once that assessment's done, and perhaps help is on the way?
Okay, the guidance covers a few key actions. First, you might see bleeding, or sometimes, in more serious cases, a clear fluid loss. That's cerebrospinal fluid, CSF, maybe from the ears or nose. The guidance says you should try to control this bleeding or fluid loss if possible, maybe using a sterile dressing, gently.
Right. Manage any visible trauma first. And then positioning. What does the source recommend for positioning the casualty, if they're conscious?
Yeah, for a conscious casualty with a head injury, the general treatment principles in the sources suggest placing them in a comfortable position, preferably lying down on a flat surface with their head and shoulders slightly raised. This can help with comfort, maybe reduce some pressure.
Okay. And throughout all of this, monitoring is absolutely crucial, isn't it? Feels like that comes up again and again.
It is nonstop, really. Continuous monitoring of the casualty's condition is essential. You need to keep a close eye on their level of consciousness, their breathing, any developing symptoms. Head injuries can deteriorate, sometimes quite rapidly. So watching for changes is a core first aid responsibility.
And if that deterioration happens, or maybe if the casualty was unconscious right from the start, you need to be ready to do more.
Exactly. The sources state you must be prepared to carry out basic life support CPR if the casualty's condition worsens significantly, or if you find them unconscious and they're not breathing normally.
Okay. And the guidance for an unconscious person who is breathing normally. That changes things slightly, doesn't it? This is standard first aid, but worth repeating here.
Yes. If you find a casualty unconscious but they are breathing normally and they're unresponsive, the general guidance is to place them in the recovery position. That helps keep their airway open, stops them choking on their tongue or any vomit.
But there's a big but, isn't there?
There is, and this loops back to that warning about skull fractures and spinal injuries. You must not put them in the recovery position if you suspect a spinal injury. In that case, you keep them exactly as you found them. Do your best to keep their head and neck still, immobilized, while still monitoring their breathing, of course. And always be ready for basic life support if their breathing stops or becomes abnormal.
Right. And if they were unconscious and not breathing normally.
Decision then. You start basic life support immediately, beginning with chest compressions.
Okay, that gives us the essential framework assess. Call for help if it looks serious. Manage immediate issues like bleeding. Position carefully. Monitor constantly. And be ready for BLS. Now let's zoom in on those two specific questions, the ones that come up time and again, especially on first aid courses and definitely for anyone looking after kids. First, the big one for parents and carers. Can you let a child sleep after a head injury? The common advice, the sort of old wisdom, was always never let them sleep. What does the actual UK guidance say now?
Yes. This is such a source of anxiety, isn't it? And it's a perfect example of where the guidance provides real clarity based on the latest understanding. The specific guidance on child head injury and sleeping in the UK is clear. It is generally safe to let a child sleep after a head injury if they want to rest.
Wow. Okay.
Sleep is actually seen as beneficial for recovery.
So that flies right in the face of what many people believe. That old never let them sleep advice is actually, well, wrong according to current guidance.
Essentially, yes. The old advice often stemmed from the fear that a sleeping person couldn't be properly monitored. But the guidance has evolved. While letting them sleep is okay for rest, it comes with an absolutely critical condition, one the sources emphasize repeatedly. Close monitoring is essential, especially within the first 24 to 48 hours, depending on the child's age. This is completely non-negotiable.
Okay, so it's not let them sleep and forget about it. It's let them sleep while I actively monitor. How does the guidance tell us to monitor them, especially if they are sleeping? What's the vital check?
This is the key insight from the source regarding sleeping children. You must ensure that the child can be easily woken when you check on them periodically.
Easily woken. That's the test.
That is the test. Can you rouse them easily? Get a normal response. You need to check them regularly, especially through the night. Actually wake them enough to ensure they respond normally before letting them drift back off.
And why is that easily woken check so critical? What are we actually looking for or trying to avoid missing?
It's directly tied to spotting potential worsening of the injury. Difficulty waking a child is a major red flag. It can indicate increasing pressure on the brain or other complications. Cerebral compression, perhaps, though you don't need the label. By checking that they are easily rousable, you are actively monitoring their level of consciousness. That's one of the most sensitive indicators of a deteriorating head injury. If they become difficult to wake, that's an emergency sign. Get help immediately.
Speaking of emergency signs, the guidance lists specific worsening symptoms that, if you see them while monitoring awake or during those sleep checks, mean you must seek immediate medical help. What are those red flags?
Yeah, the sources highlight several key ones. If the child becomes unusually drowsy or sort of clumsy, uncoordinated, if they're persistently confused or irritable, and irritability is really important in babies and toddlers who can't tell you what's wrong, if they develop strange behavior, have difficulty understanding things or speaking clearly, and importantly, if they have repeated vomiting, so vomiting more than once.
Okay, repeated vomiting is a big one.
Definitely. And as we just discussed, if they become difficult to wake, or if you find them completely unresponsive, any of those symptoms mean you need urgent medical attention. Call 999.
Are there other points the guidance makes for parents or carers about managing a child's recovery at home, assuming it's a less severe case?
Yes, the sources mention you should avoid giving the child sedatives or sleeping pills unless they've been specifically prescribed by a doctor after they've been assessed. And as they recover, it's about a graduated return to their normal activities. So taking it easy, avoiding strenuous exercise, and definitely contact sports for a period, usually guided by medical advice on that.
And for any parent or carer who is just still feeling unsure or worried, even after monitoring and checks, the guidance is very clear on that too, isn't it?
Absolutely. It empowers you to trust your instincts. If you are unsure or concerned about the child's condition for any reason at all, you should contact NHS 111 or your GP for advice. Don't hesitate. And crucially, if the child lost consciousness at all during the incident, even if it was just for a few seconds, you should seek immediate medical help. 909 or A&E. Regardless of how well they seem afterwards, that brief loss of consciousness is a significant marker according to the guidance.
Okay, so to really land the point on sleeping, the myth that you must never let them sleep is busted by the guidance. Rest is fine, even good for recovery, but the vital takeaway, the absolute core requirement is that active, diligent monitoring. And that critical check that they can be easily woken. It transforms letting them sleep from being passive into an active part of your monitoring strategy.
Precisely. It's about informed monitoring, not neglect. That's the difference.
Okay, let's pivot to the other frequently asked question, especially when someone has a visible bump. The cold pack. Should you put a cold pack on a head injury? It feels so intuitive, like for any other bump or bruise.
It does feel intuitive, yeah. And this is another point where the source material offers clarity by being really specific about what you are treating.
Okay. So what does the guidance actually say about applying cold?
Our sources list cold application, often using an ice pack or something similar, the Eisen race, rest, ice, compress, elevate, as a recommended treatment specifically for contusions.
Contusions, which is the medical term for it.
A bruise, exactly.
And how does the source describe a bruise, just so we're clear?
It's described as damage to the small blood vessels, the capillaries, just under the skin. They break and bleed into the surrounding tissue, causing the discoloration and swelling we see as a bruise. And the sources mention applying ice always wrapped in a cloth, never directly on the skin, for maybe 15-20 minutes to help manage the swelling and pain associated with that bruise.
All right, so ice is listed clearly under the treatment for a bruise. Standard stuff. Now, here's the crucial distinction based purely on the source material we've looked at. When you look at the general first aid guidance provided in these sources for treating a head injury itself, the potential injury under the bruise, does it include applying a cold pack?
No, it does not. The recommended first aid steps provided for managing the potential underlying head injury focus, as we've discussed, on assessing the severity, controlling bleeding if there is any, positioning the casualty, monitoring their consciousness and symptoms very closely, and being ready for basic life support. And, of course, prioritizing getting professional help for suspected major injuries. Cold application is not listed among these core steps for the head injury itself.
Ah, okay, so this clarifies the myth then. The common practice of putting ice on a head bump isn't necessarily wrong if the bump includes a bruise, because the sources say ice helps the bruise. But the ice is treating the bruise, the visible external damage. It's not listed as a treatment for the potential internal head injury. Is that right?
That's exactly right. The first aid guidance provided for treating the potential underlying head injury goes way beyond just managing the superficial bruise. The focus for the injury itself is on observing for signs of something more serious happening inside the skull and knowing when to activate the emergency services. So while ice can definitely help the sore bump and the bruise on the outside, it's not listed as a treatment for the head injury in the same way that monitoring consciousness or calling 999 for specific symptoms is. The priority for the injury itself is always that monitoring and seeking professional help if needed, based on the guidance.
That really puts it into perspective. It's not that cold packs are bad or harmful necessarily, but according to this guidance, their role is limited. They manage the bruise, which might be a symptom of a head injury, rather than being a core first aid step for the potential underlying injury itself. The real work for the injury is the monitoring and getting help when needed.
Precisely. And it's that understanding of why the guidance says what it says that helps first aiders, parents, everyone apply the principles correctly in the moment.
Okay, let's bring all of this together then. For our listener, whether you're just starting out in first aid training, you're a busy parent, or maybe a carer in childcare, or a first aider in the workplace, just refreshing your knowledge, what are the absolute key takeaways from this deep dive into the UK guidance?
Okay, key points. First and foremost, take all head injuries seriously. Because of their potential for severity, even if they seem minor initially, don't dismiss them.
Number 2, know when to call 999. This is critical. Suspect a major injury based on how it happened or your initial check. Call. See those specific worsening symptoms we talked about? Repeated vomiting, confusion, severe drowsiness, or especially difficulty waking them? Call immediately. Don't wait.
3, for that common question about children sleeping after a head injury, the guidance says resting is fine, it's actually beneficial, but it's completely reliant on active, diligent monitoring. The vital check is ensuring they can be easily woken when you check on them periodically. That's how you monitor their consciousness while they rest.
And 4th, regarding cold packs, the guidance lists them as a treatment for the bruise that might accompany a head bump. Helps with swelling and pain on the outside. But the core first aid for the head injury itself is focused on assessment, monitoring for changes, and knowing when to get professional help based on those critical signs. The ice treats the symptom, the bruise, not the potential underlying problem, the injury.
And remember those core aims. Preserve life, prevent worsening, promote recovery. By understanding and applying these simple, clear steps from the guidance, knowing what to look for, what to do, and most importantly, when to get help, you are performing effective first aid. That's the goal.
This knowledge truly empowers you, doesn't it? You don't need to be a medical expert to make a real difference. The guidance, based on all that UK experience in pre-hospital care and training, simplifies it into actionable steps. Knowing these basics, especially for looking after children or in those immediate moments in the workplace or at home, it helps reassure nervous future lifesavers, and experienced ones too. You can make a positive impact by knowing these principles.
Confidence in first aid comes from clear, reliable knowledge, and that's exactly what these sources aim to provide.
This has been a really vital deep dive into an important and yet often worrying area of first aid. Thank you for joining us.
And thank you. Being prepared and informed makes all the difference when it truly matters, doesn't it?
It really does. To leave you with a final thought based on the source material we've explored today, a thought that really echoes the fundamental responsibility of a first aider. Remember, effective first aid isn't solely defined by the immediate bandaging or positioning you do, important as that is. It is perhaps defined even more critically by knowing when and how to transfer care. Knowing when the situation demands professional medical assistance and making that call clearly and quickly, as the guidance itself puts it, with stark simplicity. If you have not contacted the emergency services, then they will not arrive, end quote. Knowing when to make that call is arguably the most critical piece of effective first aid for potentially serious injuries, something to really think about.